Soares is the current editor-in-chief of the Cochrane Library, and she recently took over that position from David Tovey. She was in the position of deputy editor-in-chief with David. Before that, David was our first editorial chief. And Karla has an amazing background. She comes from Brazil, and she did a PhD at Oxford and in epidemiology and also evidence synthesis, and completed 60 or more now systematic reviews. So it's just something that makes my jaw drop, because I've done 2 systematic reviews. And I like to tell people in the Cochrane that it's sort of like going through analysis. You have to do at least 1 systematic review to understand the basics of what it means to be in the Cochrane and do the work. And it is a lot of work. So to do 60 of them is just amazing. And now to be the editor-in-chief of our Cochrane Library is a very, very important position, especially at these times of crisis and COVID. And many members of the Cochrane Library are truly inspired by the fact that the Cochrane Library is now open access to all at these times of crisis. It's probably something that would make Archie Cochrane, who the library is named after, very proud. It's not clear the business model will continue indefinitely, but at least for these times of crisis, I think it's very inspiring to all the more than 25,000 members of Cochrane. So with that, I want to introduce Karla Soares to us. I want to take care of just a couple housekeeping issues. We will be recording the session so that people who cannot make a session today can view it later. And we will be taking questions in the chat box. Karla, would you like to take the questions as they come or hold them to the end?
I think it's probably better if we hold to the end, but if people feel that it's very important to ask before, I'm fine as well. I don't have it.
Okay, so we will probably hold them till the end unless you put in the chat box. Please answer now. So without further ado, I also want to give the opportunity to our, I'm Bob Dellavalle, the director of US Cochrane, Colorado, and we have the co-director, Patricia Hain, who was the mastermind of bringing Karla in, and I just wanted to give her the opportunity to say hello to everybody and to welcome Karla as well. Patricia, are you able to talk?
Yes, I think so. Yes, I want to welcome everyone for this very important webinar that the University of Colorado, the Cochrane Affiliated Center, is sponsoring. And it is our honor to have Dr. Karla Soares-Weiser delivering the lecture today. I also want to thank our members from our affiliated center, Dr. Hoffiker, who is also helping us with the webinar and the technology, and our executive committee members. And without any further ado, I would like to introduce Karla and give the podium to her. So thank you very much, Karla.
Thank you, everyone. What Patricia forgot to say is that we have something in common. We are also both Brazilian, so bear with me if there is some kind of mafia Brazilian here, and if we start speaking Portuguese. But I guess that, in these times of international collaboration, one of the things we've learned is that there are people all over the world that is trying to work together. What I'd like to share with you, so I hope you are all okay. This has been a very challenging time for all of us. I myself at the moment had to move back to the UK because they didn't organize themselves regarding visa. The people like me that work here and live elsewhere. So I had to move without my family. So these are very challenging times. And I think one of the things that I've learned in this process is the importance of collaboration and the importance of Cochrane as an international organization. So everything I'm saying here, I basically, to be fair, have not done much. This has been the work of many, many people. The central team, the Rapid Review Methods group that has co-conveners in Austria and in Canada, main Cochrane review groups, and I expect at least one of our senior editors, Mike Brown, I think he's in this call, but we have a number of, for those of you that don't know, we have 52 groups and 8 networks, but also we've worked very close with many centers, including the US network and the centers inside the US network. We've also got involved consumers on this process, and basically the community as a whole. And my inbox is it's full every single day of people offering to help. So there is something very interesting about the crisis like that, is that puts people together. And in a way, this is it has always been the modus vivendi for Cochrane. And it's very, very interesting for someone like me. Like Bob said, I was here in Oxford 25 years ago. And when I first came to Oxford, I was a young person, never have left Brazil before, was the first time. And I didn't really speak a lot of English. I was very hardworking. And many people in the organization have taught me everything I know, basically. And they were, Cochrane was like a family for me. And Cochrane grew, and there is a lot of fantastic things. But there are things also that we have to take into consideration, that what worked well in 1995, it might need change in 2020. So the process that we went through is actually to test some of these changes and how much the organization was ready to speed up some of our process. And it has been very interesting. But by all means, it's a work of many, many people. So again, I'm assuming that not all of you that are participating are directly involved in Cochrane. We basically produce systematic reviews. That's our job. And we are a global health research charity. And the key thing for Cochrane is that we produce these reviews with established guidance and standards. And this is very important because with this rapid process, we have not given up guidance and standards, because we think it's very, very important that whatever we put, make public is the best quality that we can put. As in general, our work involves as I said before, the 8 thematic networks and 53 Cochrane review groups. This process in itself, obviously some of the groups, in order to speed up the process, we've been working with a number of groups and a number of networks. And one of the things for Cochrane systematic review is that every review has to be preceded by a published protocol. And the second thing that it's important, and it's the fact that we have mechanisms to update evidence. And here, this becomes even more important because the evidence here is changing every day. And the other thing is that we actually have very strict conflict of interest policies. So we pride ourselves for being independent and transparent. So with these are things that we actually took on board when we started this process, what seems an eternity, but is a month and a half ago. There has been quite a number of research trying to compare systematic reviews that were published in Cochrane with systematic reviews that were not published in Cochrane. This was published in 2016 by Matt Page and colleagues. And what they showed is that in most areas, Cochrane reviews are of higher quality than non-Cochrane reviews. So this is very important for us. Is it something that we want to remain on the top and improve, not going backwards? The other thing that is important in a pandemic like that is that the Cochrane Library is actually access for the Cochrane Library is worldwide. As Bob said, in the past 2 months, we have made the Cochrane Library open access. I think that what we're trying to do is to be able to create special collections that are tailored to the situation, and one of the things that we've seen is that these special collections are highly used. It's amazing that I receive information about the usage of these special collections on a daily basis, and it changes daily nowadays. So in my view, we needed to open the library until we get a number of the special collections. But what clinicians, basic clinician needs at the moment is actually tailored information. So we're also investing on creating clinical answers and investing quite a lot on having plain language summaries, because we know that these are the material that people translate to other languages and make it more accessible. So with this in mind, just giving a little bit of timeline, because even for me sometimes it's hard to understand how this came up to us in such a short time frame, and the many things that we had to put in place. Basically, there were concerns that starting January, and WHO defined the research priorities in February. We had initial conversation in mid-February with the World Health Organization. Then in early March was declared the pandemic, and we started our work on the second week of March. What we wanted to work on were priority setting. So we put together a website on which we asked key stakeholders, government agencies, World Health Organization, funding agencies, what were the key questions. And to be fair, we thought we would receive something like a handful of questions. And 2 weeks ago, we had to make a decision to stop the priority setting list because there was already 240 questions, and we had to deal with them. And that's what we're doing now, and I'll show a little bit later, and categorize them. We also worked very close with the Rapid Review Methods Group. We understood that we needed to produce and publish rapid reviews, but we wanted clear standards and guidance. And for me, what was more important is to say when was needed and what were the limitations of these type of reviews. And then we also had a completely change on our fast track process in order to accommodate publications within 2 weeks. And I'll give you more details later. This is all, as I said, this started on second week of March. We started in April, we launched our website, the COVID Rapid Response website. We also published 4 rapid reviews, and I'll give you a little bit more of information later. And we also published our living repository of studies. And so in early May, granted that today is the 6th of May, we started working in late April, but we set a small subgroup of our working group to look at living evidence, the key questions that are relevant for living evidence, partnerships, because we realize we cannot do everything and we need to partners, and most importantly, as much as possible, avoid duplication of efforts. And going forward, what we are considering is how we use this experience to support preparedness for future outbreaks or for the continuation of this outbreak. So this is the timeline that we've worked on. What have we managed to do? And as I speak to you, there was another special collection published just now, but we as I said, for a limited period of time, we made the Cochrane Library available free of charge for all. We are now reviewing these and seeing how useful this has been. But I can tell you that the most useful thing is where the Cochrane reviews that were put together in special collections. So this is the one of the areas that we are concentrating, because we see this is a way of producing short summaries of translation of these key reviews, keep these reviews up to date, and make sure that the new evidence is incorporated to this review as soon as possible. The reviews that are, so one of the collections that we first launched was about critical care, and another one about infection control. And then we launched one on options for quitting smoking, because the World Health Organization has worked with us and identified it as one of the key risk factors. And we launched another one about regional anesthesia to reduce aerosol generation. Today, we published the remote care telemedicine, and we are working to publish within the next 2 weeks, one on working from home, home care for risk populations, and mental health issues. We also launched a repository that I'll show you a little bit later, but has now over 3,000 references. And as I said, we fast-tracked key reviews. So we fast-tracked an update of the PPE review. And 3 rapid reviews, one in quarantine, the other one in alternative to soap, using ash or other ways of cleaning your hands that are particularly tailored for low and middle income countries. Another one in barriers and facilitators for the use of infection control measures by healthcare workers. So, and we keep thinking and are open both for the key reviews and also for the special collection. So this is a moving area for us. What did we do in terms of our fast track? We had a fast track beforehand. We had a centralized editorial process that had a commitment to publish Cochrane reviews between 7 to 14 weeks. But we realized that in this situation, these timelines were irrelevant, basically. So we put together a resource in our fast track in terms of increasing the team. And we put together a process that involved quality assurance within 4 days. That within this quality assurance, there is a consideration whether we should do preprint or not. At the moment, we're still considering the issue about preprint because of the many issues in terms of reliability, etc. We are finalizing our editorial process within 2 weeks, and then these reviews are being published in the Cochrane Library. As I mentioned, we published the quarantine review, the qualitative evidence synthesis on barriers and facilitators for healthcare workers' adherence with infection prevention control measures, the personal protective equipment that was an update, and the efficacy of ash as an alternative to soap for cleaning hands. We are in the final editorial process of a review. It is actually a living systematic review looking at the safety, and effectiveness of convalescent plasma. Another one on effectiveness of video call for reducing social isolation, especially in the elderly. And we are working very close with the diagnostic test accuracy group, and we're putting together 5 reviews assessing the diagnostic test accuracy. And the first one on antibodies are about to be submitted. So we are all very, very ready to start the fast track and publish this review as soon as possible. So these are only some of the reviews that we are publishing. But we do know that one of the things that is happening is new studies about COVID-19 are being published every single day. It's amazing the amount of studies. So we know that Cochrane is well placed to respond to keeping these reviews regularly updated. We are considered a trusted source of evidence, and more than anything, we have worldwide members with expertise in producing these reviews. So we're trying to capitalize on that. We've created, as I mentioned, the living repository of studies. We also created a working group to look at the priorities for living systematic reviews. In our sense, not all the reviews that we're publishing should be considered as a candidate for living systematic reviews, but we should look at the areas on which the evolving evidence will make a difference. But we're also looking at ways that we could support the preparedness in low and mid-income countries. So we've published the first wave, but we're working very close with the World Health Organization. And for us, one important thing is actually to identify ways, because at the moment, we have a huge amount of people offering their support. But we know that as time goes by, people go back to their work, and to keep these reviews updated and maintained, you know, at least the top priority reviews will be a process that needs to be considered now going forward. So, as I mentioned to you, one of the things that we thought that would be facilitating the production of reviews is using our own technology and the advancements in terms of artificial intelligence that we've considered in the past 5 years. So basically, we have a centralized search that in terms of the source of specialized registers, and we produce a database that is also part of the Cochrane Library, the Central. And what we did is that to use the same mechanism, but also making use of the crowd, making use of the machine learning, and making use of linked data, annotation of this evidencia, to create a process specifically for this COVID material. So what is different from for example, what PubMed is doing is that we're not talking about reference, we're talking about the studies. And each one of the studies are annotated in terms of the population, intervention, control, and outcome. And because this is an area that is not only based in randomized control trials, what obviously Cochrane has more expertise than other areas, we are also looking at annotating evidence from all the studies, all study design types, and create a database that, and that's how it looks like. So the database has information about the study type, the aim of the study design, and the intervention that was assigned whenever applicable, because as I said, it's not only based on randomized control trials. So for example, what is the importance here? The quarantine review was published less than a month ago, but then if you look at this of the register is updated daily, and I searched simply for quarantine, then you see that even within the last week, there were 11 new studies. And I want to emphasize that the register is not about reference, it's about the studies. 11 new studies published, and within the last month, 85. So it's a very big evolving register. And what we would like to achieve with that is a way that the authors producing these draft reviews would not need to search the literature, and they would, with a simple search, they would identify all the relevant studies. The current register includes 3 databases, including PubMed and WHO, but we are now incorporating the Chinese studies that one of our centers in China have actually participated on translating these studies to English. So we're now looking at how we incorporate, because we would like our authors to have a source of information and to really make use of this to facilitate their review production. So, and also the other thing, as I mentioned, is that we have information about the study type and the study design, and we are including information about PICO that should be available within 1 week. Basically, the important thing of all of these is that we do know that we have a role to play on synthesizing evidence in the evidence ecosystem. We need evidence that is of good quality. At this point, we need evidence that is produced rapidly. And the importance of it is that this will be then the evidence. We also need to find ways that we support the dissemination of this evidence. So another thing we're looking at in this process is how we actually facilitate this dissemination by producing. So we've employed a journalist to help us looking producing the plain language summaries, because this facilitates the way these plain language summaries are translated or are used in with the media to facilitate it. And I just wanted to give you some examples of what we are doing. And one of them is, if you go to our Cochrane page, so if you go to the Cochrane Library, you see on the top bottom of the Cochrane Library a page with everything that we are doing in terms of the coronavirus. So we have here update daily. So everything that is happening, it's daily updated, although you can see that's May 4th. So and you have here information about the special collections, about groups that are working with us. So for example, we have a group of consumers that are working and helping us with peer review, so that we know that the information that we are producing has this background. But we also have a Cochrane crowd working in screening the reference, the reference in supporting the register, so that we don't give you the number of reference, but the studies that are available. And as I mentioned to you just today, we have published the special collection on remote care through telemedicine. This has just been published an hour ago. And you see, for each one of these special collections, there is an editor that was responsible for signing off the collection, and he was responsible to put together what are the reviews that will take part on this collection. So you have all the reviews are free access. Some of them are open access. What's the difference? If they are open access, someone else paid. In this case here, these were reviews conducted by for the WHO, and the WHO then paid the license so that these reviews are open access. And so you should have a look and see. So you can see here that we have topics that communication systems to facilitate healthcare remotely, but we also have asthma and COPD, cardiovascular conditions, mental health and neurological conditions, genetic disorders, abdominal and endocrine, fertility, pregnancy and neonatal, eyes and visions, skin, and you have, for every single of them, you then will have, if you click here, you go straight to the Cochrane review. So again, as I said, I think this is one way that we can provide support to busy clinicians, but also it facilitates for us to prioritize updates if some of these reviews are not up to date. The other thing that we've launched is that we created a website that provides information related to our fast track service, but also guidance in terms of methods for rapid reviews, the questions that we've been prioritized, the question bank that I mentioned to you, and our process. So if you use this website, for example, if we go to the question bank, these are the 240 questions that I've mentioned to you. And what we've done now is that for each one of these questions, we have tagged if the review is in development, and if it's in development, if it's being done, produced by Cochrane or not. So because we have been told that these are important information for people that when they want to consult. But we also have some tags of reviews that have not yet been addressed and or have been published. So it is a source, it's an evolving document because of the amount of information that the amount of questions that we've received. But it is a source of information, not only for reviews that are produced by Cochrane, but also for many reviews. And our attempt here, it was to avoid duplication of effort. So if you click here, you see that 48 reviews were being developed, but it's not a Cochrane review. And you can see also which one of them are Cochrane review or are being considered as rapid review. Well, another important thing, so the question bank, there is explanation here what we are doing in terms of the prioritization process. There is a possibility of submitting a question that at the moment we have paused because, as I mentioned to you, the number of questions that we received. And there is information here about all our process in this crisis of how what we are accepting in terms of Cochrane rapid review. So, for example, we consider that parts of this process are extremely important, even if in a rapid environment. One of them is that the composition of the team. So it's probably more important that the team has expertise than if the team than in a usual situation, because basically once you agree the timelines, these timelines are within the maximum of 2 weeks. So everything is done. So for example, one of the quarantine review, what they did is that they've added, I think it was 16 authors in the review in order to increase the resource and facilitate the process, because the review was conducted from the beginning to the end in 5 days. So the reason why we put this process here is actually because we'd like to make sure that people consider this before they start doing a systematic review, a rapid review. Because rapid reviews, in order for them to be, for the results to be accurate, you really have to make all these considerations in advance. Regarding the fast track, we are working, as I said, in a 2 weeks timeline, but we are on an acceptance rejection mode. So when we do the quality assurance, if there are major issues and the review is a priority, we will provide one opportunity for the authors to review the comments from the peer reviews and the quality assurance. But if there are major issues and the review is not being considered a priority, we will then reject the review. And the reasons for that is because we had to really make sure that we use our resource wisely in such a short time frame. And the other thing I want to call your attention for is in the same website, the Cochrane COVID Rapid Reviews, you find quite a few resources. So you have a workflow document to help you plan for the rapid review. You have a template, a protocol template. You have the template for the full review and a series of documents of guidance from the rapid review methods, guidance in terms of qualitative review, prognosis, and DTA. And I want to say that, you know, we are consider some of these rapid reviews. And what we'd like to have in mind is that these rapid reviews, once they became, if they are considered important and will be continued as a living systematic review, they'll then be continue. We might need some work to be able to continue them as a regular Cochrane review. The other thing that is important to say is that many groups are working with us and deciding to do a full Cochrane review done rapidly. And what's the difference here is that they don't compromise on anything in terms of methods. So that's more or less what I had to say. I realize that there are some questions here already, and I'm happy to consider the questions. I don't know how you want to, Bob, you want to organize the questions, but and I'm more than happy to, you know, to be here to respond to questions, but also to share the presentation later on with everyone.
Sure. Thank you so much, Karla. That was fascinating to hear about all of the many things that Cochrane is doing right now. We do have a few questions that have come in through the chat box, so maybe I will just read them and let you think about a response and tell us if you want to answer them.
Okay, all right. It's good to be able to pick and choose.
So the first question is from Adam Hofberg, and he writes, are there recommended tools, and all of these are in the chat box too if you want to read them yourself.
Yes.
Are there recommended tools Cochrane uses for identifying study design, specifically within the many types of non-RCT observational designs?
Adam, this is a very good question. Cochrane obviously is much more familiar with RCTs, so we are stretching our limits here, but we are working very close with the Public Health Network. The Public Health Network is probably where you have most of the reviews that involve non-RCTs in Cochrane. So for example, the qualitative review that we publish, we consider that as a top priority. And we've worked very close with the EPOC group in Cochrane to be able to conduct that review in a very short period of time. So we're using the same tools that are recommended in the handbook. But it's still, there are areas that it's completely new areas to us. So for example, the quarantine review had some modeling, and we had to go and use more external peer reviewers with understanding and expertise. One thing I want to say to you is that the methods part, I think the handbook will have most of the information. But one very important thing on these rapid reviews that we are seeing is that a lot of the reviews, if you do not involve content experts from the beginning, where you're planning the question and developing your PICO, that's where the review came to us and it's being rejected. Because that's really more, I mean, most people in Cochrane, you have a lot of people with very good methodological background, but it needs a combination of the background, the methodological and clinical background. So the tools are available, but the interpretation of this information, especially when the review is done rapidly, is very important as well.
So the next question is from me, Karla. Have you had to reject many rapid reviews yet?
Yes, and it is, I mean, Cochrane is not very good on rejection. It is a consideration that we have to deal with, but yes, the fact it's probably half of the reviews that we've received, we had to reject, and it might even increase the amount of rejection going forward, because we are open for for people to come, and basically what we are putting in place, again, everything I'm saying is very much on the reviews that we are prioritizing, because this is where we are putting our resource on. For the reviews that we are prioritizing, we have now a member of the rapid review methods group working with the author team in terms of the creating the protocol to make sure that the protocol has what it takes. Then we have a quality assurance of the protocol. And once the protocol is accepted, not necessarily published in Cochrane because it will take longer, so it can be published elsewhere, but the protocol is accepted, then the authors are working and have the support of the method support unit. Because we understand that the most important thing, especially for these priority questions, is that we have the review conducted right. We don't want to compromise on that.
The next question is from Paula Williamson. Have reviewers been advised to consider COVID-19 core outcome sets to inform their protocol?
Yes, Paula, we have advised that we have also received from many clinical experts that is very challenging to consider core outcomes for COVID-19, because most of the interventions so far are actually interventions that are used for other calls. And we actually have one review now to look at symptoms of COVID-19 because it's not clear. So I think we should be working together and incorporate these things. But when we started, it was really challenging to consider these different questions with one set of core outcomes. I realized that you've been working on a set of core outcomes for a number of different areas, and I think we can get better on that actually.
The next question is from Ian Saldanha in Providence, Rhode Island. He asks, post-COVID, or more accurately, post-COVID emergency phase, how do you see Cochrane reviews changing in the future?
Well, Ian, that's the question I sleep and wake up every day with. I can talk to you hours about that, because I think, for me and for the whole leadership of Cochrane, this has been a very interesting process. And we're looking at an evaluation of this process that will not happen now because we are in the middle of things, but once we calm down a little bit, and there is quite a few things that we need to consider and go back to our community and discuss, because we've learned quite a lot of lessons. So for example, we've been dealing with the issue about whether use preprint, use the possibility of preprint of Cochrane reviews for a long time. And there is always a reason why we can do it tomorrow. And with this situation, we had to go and incorporate all the information, work with our publisher, and we have everything ready to go. And then we had a meeting today to see, is this the right condition? Because this is really something that it's immediate, and probably possibly in another month may be different the way we approach this the post-COVID phase. It's something that we don't know yet when is it. So I think, by all means, I believe there are going to be changes, and I believe that this is something that we have to have honest and transparent discussions with our community.
Our next question is very specific, and it comes from Fernando Astorga. He asks, is Cochrane working in the risk of COVID infection due to aerosol produced by dentists?
Yes, Fernando, you probably should visit the website of our oral health group. So John Clarkson, that is the coordinating editor, probably a month ago, she raised it to me. I didn't know that, to be honest, and how important this is and how this really having an effect on the whole dentistry. So she has put some information already on their website, and they are working on 3 systematic reviews on this area, specifically for dentistry. So it should come. I don't think it's a rapid review. It's a review done rapidly. When it's going to be available, I don't know yet.
And our next question is from Lillian Hofecker. She asks, will you be opening up anytime soon the question bank for more submissions?
Yeah, I mean, when we started this bank, what we thought was that we are going to try to find ways to avoid duplication of effort. We didn't want to be working on priorities that other people were working already. We were overwhelmed, basically. And what we at some point, it became less relevant because it was 240 questions. So what we're doing now is that we're grouping that questions in key areas. We are separating the questions that priorities that we are taking forward, especially now we start looking at living systematic reviews or reviews that need regular updates. And also make sure that people know the questions that other people are not conducted. So we have a dedicated website, and we're working with our support team. This process should be completed by the beginning of next week. Once this is completed, we want to evaluate how it is and give some time for people to use the process, and then we will open again. We just felt that was, becoming an impossible mission to try to really have a bank that it didn't make a lot of sense. So we're really trying to make sense of what we have at the moment.
Let's see, we have a question from Patricia Hain. She asks, how can we help or volunteer in reviewing the reviews?
Oh, one of the key things that we need help with is actually peer reviewers, to be honest, because we are giving the peer reviewer something like 24 to 48 hours. So we have a process that's much more streamlined, and we're using, there is a dedicated email for that. But the clinic, as I said, one of the issues that we had with most of the reviews that we had to reject was that it didn't make sense clinically. Even, and for 3 of these reviews, actually the group doing the reviews were fantastic methodologists. So we are really very keen that we have these 2 areas, that we have the methodologists and we have the clinicians and we have consumers. So we have some people, there is a consumer group as well, and we're really trying to look at using also the information from consumers on our peer reviews. There is a dedicated email, Patricia, in the website, and I can also share with you later. But yes, we welcome support. What we're doing is that we're working with the UK Cochrane Centre to match the offers, because we received so many offers that we were not able to respond to everybody. So the UK Cochrane Centre took this task of matching the offers with the skills that are needed. Sometimes it's to join a team because the team is conducted and need a certain expertise, or sometimes it's peer reviewing or giving us, work with us in certain key areas that we need in order to make a decision. But yes, we welcome, and that's been something that I'm really very grateful and very proud of being part of this organization, because as I said, it's amazing the amount of people that have been offered and have been participating on this process with us.
Karla, you have time for a few more questions?
I'm happy, I'm here. It's fine.
Okay, wonderful. We appreciate your time. I know you're busy. Another question is from Lillian Hofecker. How much do consumers participate currently?
So I actually checked this just before I came to this meeting, because what we were trying to do is to create a network of consumers, and that they would be ready for when we need. So for example, the same type of tasks, if they need the consultation in terms of the PICO in certain reviews, or if they need to be consulted in regarding peer review process. This is being facilitated by our consumer network. It's working. It is lower than we would like to, but as I said, among our staff and also the CRGs, it's quite a few people that actually had been infected. So you've probably seen that Paul Garner published yesterday on the BMJ a blog telling his story, that he has been with 7 weeks. He's been working very close to us. And one of the things that he pointed out, it was that this thing about saying that the symptoms is 2 weeks, it's really not true. And so if you have not seen this, it's a very good blog that was published yesterday in the BMJ. And it tells a story, tell his story about the disease. But he has been sick for 7 weeks, and he's enlightening me all the time. No, don't think about that. Think about that, etc. So yes, we are using information. We're trying our best to get information, participation of consumers. It has been is lower than we would like, but for these top priorities, we certainly want this involvement.
Okay, our next question comes from Tanjing Li. She says, unprecedented time requires unprecedented response. Kudos to Cochrane and Wiley to make the library open access. Where are we in making the library free for all forever?
Well, I think it's a good question, Tanjing Li, and it's not a question that we don't discuss in a very regular basis. But as you know, most of the open access journals, someone behind this pays. Someone has to pay the bill in order to be able for us to deliver. And that is one of the things. One of the key targets for 2020 before COVID was actually a discussion, and including a survey, but including face-to-face meetings with the community to understand how can we work out this together. I don't think we have all the answers, and basically, because most of the open access process has been for journals, and this would mean that we would not be able to facilitate the production of reviews. We would have to stop training, would have to stop a lot of what we do nowadays. And we've been working very hard to try to identify funding that would facilitate the activities that we do, and in order to make the reviews open access. So we're all together on that. And but it's a challenge, and it's not a challenge that will be resolved soon, but one that we are working close, and we intend to work close with the community with.
I think I'll take the prerogative of asking you the last question, Karla, so you can begin to relax now.
Thank you, Bob. I'm relaxed. As Patricia knows, I'm Brazilian. It's very hard for me not to be relaxed, believe me.
So, as you mentioned, you became involved in Cochrane a long time ago, and I became involved in Cochrane a long time ago. We have perhaps an aging workforce in Cochrane leadership, and how are we going to motivate the next generation and the succession of who will continue all of this important work?
Yeah, so I'm going to tell you something personal, actually. As you know, I have a very close relationship with Ian Chalmers. My son is named after him, and Ian was someone very important in my career since 1995. And when I decided to participate on running for this job, one of my driving force was I wanted Cochrane for the next generation. And I wanted Cochrane to be here for the next group of people that can come and do the work, because I really truly believe on the mission that we put ourselves. We're quite ambitious, but it's a really very fantastic group of people, and I truly believe on the mission. I think this is a discussion that this process has shown us how important it is for our own sustainability that we open up this discussion and get the solutions together. I do not have the answer for you. I do understand how important it is to find solutions for this. So very much on my agenda to start these conversations. I've started already. I'm working close to a number of leaders in Cochrane, but it became even more important because I think this crisis has taught us quite a few things in the sense of how important evidence, good quality evidence is in order to be prepared for situations like that, and the role that the organization like Cochrane can and should be playing. So again, I'll be honest, I don't have the answer for you, but I certainly have the willingness to do my best and to work with the community to try to identify the right answers.
Well, Karla, I want to thank you for inspiring us with all you're doing and for joining us this morning. And I want to unmute Patricia, if I can, so she may thank you as well over the tape. And I'm having trouble doing that. There you go, Patricia.
Yes, that was an impressive, very nice presentation. Thank you so much. And I'm looking forward for the developments. I think all those new initiatives, they will contribute significantly to our knowledge and to the medical science. So I'm looking forward for all the next steps, and perhaps in terms of the involving the next generation, the early career scientists, maybe we need to think about creating a platform that is just for them to work on the reviews, and kind of a platform for more electronic, more remote, and more dynamic in terms of technology.
Yes, just to say we have one. It's called 30 under 30s.
Oh,
And what we need is probably to gather in more people and get more ideas. But we've been developing for the past 2 years.
oh, great.
Yeah.
We need
Yeah.
to learn that. That way we can add to our own, to the affiliated centers, because we do
Exactly.
work. That's great. Thanks for sharing.
Thank
All
you
right,
again,
so
Karla.
thank you all very much. It was a pleasure. I hope that was useful, and I really hope that we can continue working together and try to solve all these challenging problems that we have ahead of us.
That was extremely useful, and thank you everyone for joining us this morning.
Thank you to our
Bye.
library, to everyone. Thank you. Bye-bye. Thanks.